my name is Annabelle. I'm a social worker, and I'm going to be talking today about the role of a healthcare provider in caring for patients who may be victims of human trafficking. My interest in this area came from a project I did during my senior year while I was working on my bachelor's degree. I had been placed as an intern in a domestic violence shelter in their human trafficking program, and the project that I did was composing an issue brief for local healthcare providers, educating them about signs of human trafficking, and then providing information about how to access referrals and resources within our own community. And so that included the shelter where I was an intern. And part of that was providing education to providers, making sure that they felt comfortable helping their patients access services that we provided. And it was also to help open up that door for a collaborative relationship between medical providers and social service providers like myself. So that's something that I've continued to have an interest in and have continued to try and build my skills in. And that is something that I'm going to try and share with everyone else now. It's important that we start with a good legal definition of human trafficking. So, the United Nations Office of Drug and Crimes defines human trafficking as the acquisition of people by improper means such as force, fraud, or deception with the aim of exploiting them. There are two main areas where trafficking victims may be found engaged in work where they are likely not being paid or being paid below a fair minimum wage. So, the first type I'm going to discuss is labor trafficking. So, typical places you might see a trafficking victim could be restaurants, nail salons, agricultural settings, traveling magazine crews, factories, construction sites, or any kind of domestic servitude where they're employed in a household setting, doing childcare, housework, any other household duties, but they are often not free to leave or being held, often without actual physical restriction, but it is implied threat, or a trafficker may be holding on to their documents, or I've seen cases where children were actually not domestic victims and they were brought over from the trafficker's home country and forced to work as household slaves. So, sex trafficking is any type of sex work where somebody is unable to consent or has not provided consent for the type of work that they're doing. So, this can include prostitution, pornography, dancing, massage parlors, which are sometimes fronts for brothels, or a mail order bride. Now, it is important to note that sex trafficking um, is only a known thing if you see like a juvenile doing it. So let me back that up a little bit. So if you see someone who's engaged in prostitution, don't automatically assume that they are being trafficked, um, unless they are a juvenile and unable to legally consent. So if you see someone who's engaged in sex work and you have concerns, just ask them questions, don't make assumptions, and make sure that when you are asking people questions, you are doing it with a true desire to learn more about them and who they are, and that you are not coming off in a way that is passing judgment or could potentially cause further harm. Here is a visual representation of the AMP model. So you can see that it starts with an action, which can include recruiting, transporting, transferring, harboring, or receiving of persons. And then it has the means. So a trafficker will use threat or the use of force, coercion, abduction, fraud, deception, abuse of power or vulnerability, or giving payments or benefits. And then the purpose is any kind of exploitation, including prostitution, sexual exploitation, forced labor, slavery or similar practices, removal of organs, or other types of exploitation. So this does include organ trafficking too as a type of trafficking. It's just not one that we are going to see very commonly here in the United States. And again, it is very important to note that you can completely eliminate that M category when you are dealing with juveniles. So with juveniles, you still need to have an action and a purpose. And if you're working with adults, make sure that you have the acts, the means, and the purpose. And I like using these visual graphics whenever I think I might be dealing with suspected exploitation, and I go through and think about what action has an abuser taken with my suspected victim. How did they take this action, and what is the reason for them doing it? And that helps me determine whether or not I really have some trafficking going on. Some of the risk factors specifically for minors or domestic minor sex trafficking include childhood sexual abuse, which was identified in one study to be the greatest correlate of domestic minor sex trafficking. And then others include contact with the child welfare system or juvenile justice system. So these are your kids who are going in and out of juvenile detention or who are bouncing around between foster homes and may have been removed from their parents' custody or may at least have some contact with the Department of Children and Families. And then another factor that was identified in this study was poverty and homelessness, especially if the family environment normalizes transactional sex. So, in a family who is experiencing that poverty and homelessness, it could be that a parent is resorting to transactional sex or sex work in order to get by, or they may actually consider that to be their career. And it's one thing for an adult to willingly consent to do sex work, but for a child who is unable to legally give consent, they obviously cannot consent to sex work. And these children may still consider sex work to be a viable option to help as a means of survival for themselves. And so that's when it becomes inappropriate. And then just some other things of note is that one study found that 71% of youth in a shelter had previous sexual abuse. So these are kids who are having that contact with the child welfare system, but then also have that really high incident rate of childhood sexual abuse. And then a separate study found that more than 90% of youth in a juvenile facility had previously experienced physical or sexual abuse. So those are your kids who are going into juvenile detention, and 9 out of 10 are experiencing some kind of abuse as children. Um, and it's important also to note that DMST is notoriously hard to identify because this is a hidden crime, of course, and victims are not easily identified by us already. And then there's not enough research done to address multivariate correlation. So it's not like we can say, oh, if you check 3 out of these 4 boxes, there's a 90% chance that this kid has been trafficked. Really, what it means is that we recommend looking closer if you start to notice some of these signs. And it's really just one of those clues that there might be something else going on or that the child is more vulnerable to be trafficked, and help prepare for prevention and teaching consent. Medical professionals are probably the most likely professional a trafficking victim is going to have contact with. And part of this is because traffickers use isolation as a tactic to prevent their victims from having contact with uh, their victim support system or anyone who might possibly be able to help. Still, in this one study, it was reported that 28 to 50% of victims access medical care while being trafficked. And for children specifically, there was one study that reported about 80% of them had contact with medical providers in the year prior to their identification as being a trafficking victim. So about 2/3 of those were in the emergency department and about a third in outpatient settings. And then another thing to note is that many of these victims may not have insurance or might be on Medicaid, and they could be suffering from a lack of preventative care, either because they're prevented from accessing help by an abuser or due to poverty and other factors that might prohibit them from being able to fully take care of themselves. Just keep an eye out for chronic illnesses and conditions that could be related to a trafficking or abusive situation. Here's where your expertise is critical towards the identification of victims. So you want to look for things like unexplained repeated injuries that could be a sign of abuse or torture, patients who may be unable to speak for themselves or there's someone who insists on speaking for them. If they don't know where their documents are, ask them why. If you have anyone who has any chronic or untreated gynecological problems, or even for males, if they have rectal injuries, this is something that is worth questioning the origin and duration of the issue, especially if it seems like they are unclear about the origins or duration or are even lying about it. Try just another line of questioning. Some patients will have head and neck problems from um, being injured by an abuser. So this could be cracked or missing teeth, and then head, neck, or facial injuries. And then things like disease or infections due to unsanitary conditions. So this is where if you see someone with hepatitis, just taking another look and finding out how and why they may have contracted it. And then that education about prevention. Um, that same study that I said 80% of youth had seen a medical professional in the year prior to that identification also states that 88% of those youth had an identified substance use issue. So, this is extremely common in traumatized patients. And then another sign could be confusion about time, date, or location, especially if they're being moved around a lot or being forced to work without having control over their schedule. Other signs include psychological trauma like PTSD, um, any depression, anxiety, panic attacks, or traumatic brain injuries. Scars or marks such as tattoos that could be a name or symbol that mark a client as the quote unquote property of a pimp, or cigarette burns or other abusive injuries. And then any minor, of course, who is in the sex industry because they are unable to provide that legal consent to perform sex work. If you think that one of your patients is being trafficked or susceptible to trafficking, the most important thing you can do is, of course, to follow your agency guidelines when it comes to providing care. The last thing you want to do is break any rules or get in trouble for the care that you're providing to patients. If you suspect sex trafficking, take the time to provide appropriate sex education and access to means of harm reduction. So this can mean providing information about long-acting reversible contraceptives, and these are incredibly useful for trafficking victims because they are less susceptible to sabotage. And then also think about discussing vaccinations that prevent STIs with your patients and discussing ways to prevent HIV as appropriate with the patients that you work with. And then just continue doing regular screening and temperature checks with your patient, even if they've said no to any exploitation the first time you screen them. Don't be afraid to ask the next time if you suspect it. Sometimes it takes multiple times of asking before anyone will admit to anything that's happening. And then temperature checks, just keep checking in with your patients, ask them how your treatment plan is going, ask them how they've been since the last time you saw them, and just be willing and ready to listen to what they have to say. And then just something to be aware of is approximately half of women who are trafficked will become pregnant. And in the US, 42% of women who are trafficked give birth during the trafficking. The Affordable Care Act has included intimate partner violence screening and covered preventative services since 2012. So, any of your insured patients are going to have this provided as a free and covered service. Prior to the implementation of the Affordable Care Act, patients were reporting lifetime screening rates of about 7%. I can say for myself, I was screened for the first time when I went to the emergency room for a migraine, and I was 28 years old the first time that happened. So I had been to the doctor dozens of times before anyone ever asked me if I had experienced abuse. Um, Patients will rarely spontaneously disclose, but if you ask, up to 80% of them will disclose abuse that is going on. So the important part is that you need to ask to be able to get that accurate information. And then providers who do not screen for IPV have detection rates of about 0.5%. Asking just one screening question can increase rates of up to 11.6%. So that is a significant difference, and it just goes to show the importance of screening your patients and how much of a difference it can make in your care and in their lives. Some recommendations for screening and referrals include always screen in private. Um, it's possible that your victim has come in with their abuser, so you never know if the party that they're with could be involved in their exploitation, and that's why it's important to screen them in private, because you otherwise will not get any affirmative answers from them. Um, Avoid mentioning law enforcement because it's possible that they are afraid of law enforcement or have had negative experiences previously, especially if they've been arrested for prostitution or if they are undocumented and are afraid of deportation. If your patient discloses or you believe there's a good reason to um, suspect there's trafficking going on, then feel free to call the National Human Trafficking Hotline. They will ask a lot of questions and then refer it to local law enforcement. Their phone number is posted. It's really easy to remember. It's 888-373-7888. Don't ever call them though in the patient's presence. Wait till you've wrapped up with your screening and assessment. If you have referrals to provide to your patients, always ask permission before providing those. If they are found with paperwork that discloses a trafficking victim status, that could actually make their situation more dangerous for them. If they want your help, you can always call other agencies with them. You can help facilitate those phone calls and provide recommendations. But just be aware that the agencies often will not be able to provide much information or give you clear answers as to whether they can accept this client to their services unless they actually have the client there present on the phone to talk to. However, I do recommend calling other agencies in advance to collect general information and be aware of who provides services in your area. And I will provide some information down below for you to search for those agencies and make the process a little easier. And just the final thing to remember is always respect your patient's self determination and make them the leader in this process. Finally, here are my references for this project and for the issue brief I did a few years ago. Please don't hesitate to contact me if you have any questions, or if you'd like to share something that you are working on in your facility to provide that extra level of care to victims that you encounter. I would love to hear about it. I would also like to thank you so much for listening to this presentation, and if you have any questions or ideas about future presentations, I would love to hear about it. Um, Community education is one of my passions, and I always love hearing from other providers about what they're doing. You can contact me by leaving a comment below, or I can also be found on LinkedIn under Annabelle Minturn.